zinc. You can get about 100 milligrams of zinc in a few oysters. Even those little canned smoked oysters have lots of zinc in them. For some people, it's a great way to get zinc. So calcium, the main thing, almost all of our calcium is in our skeleton. So we think about skeletal health and bones, but also calcium and magnesium work together. When I go like this, I'm using calcium to contract my muscles. And magnesium is letting me relax these muscles on the outside of my fist. When I go like this, I'm using calcium here to contract, and I'm using magnesium to relax. And so when you see cramping or spasms or twitching or stiff muscles, you start thinking about calcium. And calcium, unlike magnesium, is hormonally regulated. And so the body doesn't like to let go of calcium that well. But if you start seeing like tight, tense muscles, a lot of soreness, cramping, menstrual cramping or other kind of cramping, nocturnal, waking up going, my leg, my foot or my calf, you want to start thinking, could this be calcium, a need for calcium? We can also get cramping and spasms from being dehydrated or needing more potassium or needing more magnesium. But when I think cramping, it's like, let's take a look at this. It's hormonally regulated, so we see these calcium deficiencies less often than we might see magnesium deficiencies, but they exist. Magnesium, for me, this is my favorite mineral because it's so easy to tell, and so many people are insufficient of magnesium. I call it the mineral. It's about let go. It's a mineral of relaxation. Some of the signs and symptoms that I see really commonly are people are constipated. Women might have menstrual cramps. There could be leg cramping. Those little eyelid twitches that probably all of us have had at some point in our life are a sign of magnesium insufficiency. Restless leg syndrome can be magnesium, calcium, or both. It can also be due to small intestinal bacterial overgrowth. One of the other signs and symptoms that I like to ask people about is, are you really sensitive to noise? Do you hear lawnmowers and garbage trucks acutely? Do you walk in the house and go, turn off that music, it's so loud, or the TV really bothers you? These are all signs of kind of magnesium, that you need more magnesium. And I remember I was giving a lecture to the Oregon Holistic Nurses Association a couple years ago, and I'm just talking about magnesium insufficiency, and I'm telling them about this list. And I'm just seeing women there, and male nurses too, but mostly the women, they're going, that's me, that's me. And when a client or patient sees this, they go, that's me. I remember I had a woman who had type 2 diabetes who came to see me. And one of the other things that I see is that people with magnesium deficiency are really sensitive. They can be really sensitive, not just to noise, but to a lot of other things. And she sat down in my office and we started talking, and she just started to cry. I'm like, let me check her for other magnesium signs, because, it was right there in my face. For a lot of women, they'll notice magnesium sensitivity premenstrually. It's part of PMS because magnesium gets used in the process of getting us ready to menstruate, and then we use up a lot of it, and then all of a sudden we get irritable and weepy. So it's one of those things, like as you start looking for it, you start seeing it. Magnesium is also really important for a good night's sleep. So somebody with insomnia, you might think about it. If somebody has severe magnesium, it might feel like somebody's sitting on their chest and there feels like a big pressure. I don't see that too often, but I've seen that a couple of times. I would certainly want to check out cardiovascular function as well if somebody said that to me. And then one of the other things I've noticed in my body, and people seem to relate to it, is it's almost like a ping that happens in your body. It can happen anywhere, but it's just like a moment. It's just like a little ping, and you go, what was that? That can be magnesium insufficiency too. Heart palpitations, arrhythmia. There's a lot of good research on arrhythmia and magnesium insufficiency. Hypertension, panic attacks, and migraines. And I would also say fibromyalgia, which isn't on this list. If you see somebody who has a constellation of a bunch of these, start thinking about magnesium. And because 60 to 80% of us are magnesium insufficient, if once you start recognizing this let go response for magnesium, you're going to see it everywhere. So here's a bunch of foods that are high in magnesium. Top 10 foods highest in magnesium. You've got spinach, squash, and pumpkin seeds. Top 10 fruits highest in magnesium is dried figs and avocados. My fig tree has been bearing hundreds and hundreds of figs for the last couple months, and I am just like so loving it. And vegetables, again, spinach, Swiss chard, lima beans, acorn squash. It's easy to get magnesium from food. You just have to eat good foods. Potassium. So potassium is part of this triad that where you start seeing cramping and spasms, fatigue, muscle weakness. You start thinking, is this calcium? Is this potassium? Is this magnesium? Heart palpitations and arrhythmia. We also have a lot of research that indicates that low potassium is involved in that. And it's interesting because the RDA for potassium it's high. It's around 3,500 milligrams a day. It's 3.5 grams a day of potassium. And a lot of people just don't get that in their diet because they're not eating a lot of plant foods. You think watermelon and bananas and tomatoes and salmon and beet greens. There's a lot of high potassium foods, but again, if you're eating ultra-processed foods, you're not going to really get that. It's also involved with polyuria. So if somebody's urinating often, you might think, why don't we just add a couple 100 milligrams of potassium every morning and see if that's helpful for that. Excessive thirst and hypertension. We've got those potassium-based salts that really help with hypertension. The problem is they just don't taste that good. And then if you've got too much potassium, you might get diarrhea, you might have an upset stomach. And of course, there are many diuretic drugs that will pull potassium and magnesium out in the urine. So always being cognizant of the drug-nutrient interactions for potassium. Zinc insufficiency. So as we start looking at zinc, we know to look at Bowes lines. We know to look at white spots in nails and poor wound healing and loss of a sense of smell and taste. Those are the things that jump out at me for zinc insufficiency. It's also involved in edema. And then we looked at all the different ways that zinc deficiency is in the mouth and the hair and the skin already. It's like this zinc deficiency. Zinc is also used in hundreds of ways in the human body. So it's important to just look for it and keep an open bottle of the liquid zinc sulfate in your office and just simply test people.
If you're a licensed healthcare practitioner ready to evolve your functional medicine practice, explore over 300 hours of clinical training, master classes with leading functional medicine clinicians, and certification pathways. Or check out the Academy of Functional Nutrition and Lifestyle Medicine at afnlm.com. Whether you're on the path to certification as a functional nutritionist or simply want to optimize your own and your family's health, our skill-building approach builds real-world competence from the ground up. And lastly, if you're dealing with chronic health challenges, visit drknews.com for self-paced courses that help you understand and address fatigue, brain fog, autoimmune conditions, gut problems, and more using evidence-based approaches. The content on this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making any changes to your health regimen. Thanks for listening, and don't forget to subscribe and share with someone who might benefit.